Hello, I'm Stephen Ross Johnson, Population Health Reporter for Modern Healthcare, and welcome to our latest edition of The Checkup. As concerns over the spread of COVID-19 have led to steep declines in patients using healthcare services for most medical issues, the psychological and emotional effects of the pandemic have had the opposite effect for mental health care services. Most notable has been the rise in need for behavioral health care among children. Children's hospitals and health systems across the country have experienced an influx of young people coming into their emergency departments for mental health related emergencies. Such increases add to growing concerns that many feel are leading to the nation to an epidemic within a pandemic of children with undiagnosed, unmanaged, and untreated mental health disorders. As a result, executives have had to find ways of handling these demand challenges, which could have long-term implications for how healthcare addresses this burgeoning crisis. With me today is Dr. Tom Shanley, President and CEO of Lurie Children's Hospital in Chicago, one of the preeminent pediatric providers in the country. Dr. Shanley, thank you very much for joining us today.
Thank you, Mr. Johnson, for having me. Appreciate it.
Let me start by asking you, what is your current situation, what your organization's current situation is in terms of dealing with the capacity and staffing and care delivery challenges that the pandemic has created within your behavioral health care unit?
Sure. Thanks, Stephen. Well, first of all, I would completely concur with the overview you provided in the introduction that we are seeing both locally in the region that we provide services and from our peers across the country, a tremendous challenge in terms of the pandemic accelerating what we had already seen as mental health challenges in the pediatric, adolescent, and young adult space. We have incurred similar types of challenges in the various domains in which we provide mental and behavioral health care. That includes both the inpatient setting and the outpatient setting. So we have a fairly multidisciplinary approach in terms of children that actually come for urgent or emergent care through the emergency department. So we are able to leverage our emergency medicine experts in combination with our psychiatry experts, along with the social work support structure that we have within that environment. We have seen quite a bit of demand, and our inpatient setting has pretty much remained full at capacity throughout the pandemic. But we were, I think, a little bit better prepared and positioned to deal with what many have seen as a real surge from that aspect by developing some programs that looked to move more upstream in what we called collaborative care program models. And I would exemplify two of those. One in the outpatient setting, where we've worked with a number of PCPs within what we call our clinically integrated network to enable them to better manage some of the fundamental basics around medication management, for example, with patients with anxiety or depression. So we tried to do that earlier, even pre-pandemic, and I think that's helped create a strong workforce to be able to partner with us in handling some of those expectations. On the inpatient side, for many years as well, we've recognized that mental health can sometimes overlay chronic illnesses or complicate those challenges. So we've embedded psychologists and psychiatrists in our inpatient setting in some pilot models to be able to support those needs. We've actually had great success with that in reducing our length of stay, for example, and being able to get them connected to the appropriate mental health support structures that they've needed. So certainly there's been an acceleration during this time, but even beforehand, I think we tried to strategically put in some programs to help offset some of those surges.
You mentioned the collaborative care model. That's interesting because I know in doing past reporting on behavioral health care, there's been quite a push within healthcare, at least within the adult behavioral health care settings, of integrating behavioral health within primary care settings. Have you seen that same type of push within the pediatric world?
I can't speak too broadly, but it certainly that's been our approach, our strategic approach as we think about our partnership with the clinically integrated network. We have about 180 primary care physicians that we have developed a module that enables them to learn. It's actually very nice for them because it's maintenance of certification qualified from that aspect of it. So they also garner the benefit of that. But it's really been working with those types of educational opportunities of arming them with the appropriate capabilities of being able to manage some basic stuff. And we've really seen that to be a strong attraction in terms of those practices. There are some needs beyond that. And so we have now started a pilot embedding psychiatry and psychology nearby our primary care practices. Our town and country practice that we have set up, Lurie Children's Primary Care, is an example of that as well. So the psychology and psychiatric trained workforce is too limited to meet the needs and the capacity demands of the current situation that we see. So we have to, I think, globally leverage different care models and different types of care providers, including primary care physicians, as you're asking. But I think this extends into the school setting, into the community-based setting as well, and other models that we can consider being able to meet these needs.
What would you say has been the pandemic's biggest impact on your behavioral health care services?
The biggest impact? Well, I think there's what we've really seen is, I would say, sort of three types of scenarios. We see one where the majority of children in the current situation have had a significant stress and strain related to a lot of the lack of the socialization opportunities. So schools, clubs, sports, et cetera. And it's unraveled some risks towards anxiety and depression. But I think the vast majority, what we're seeing is we get them connected in to some of our programs. They're continuing to do very well, and they have great resiliency. I think, and I think the majority of kids will do well through this pandemic. Certainly it's going to be a memorable event, but I don't think there's going to be a long-term impact on the majority of those children. But we've also have a couple other scenarios. One with children with and adolescents, young adults with mental health diagnoses, and the lack of perhaps confidence in coming into the healthcare environment because of viral transmission risks, et cetera, have probably left them undertreated and undermanaged. Or there could be access issues as well that we've seen throughout this in terms of a contraction of pediatric mental health services from that aspect. So underserved and undertreated or managed children, I think, have had an accentuation of the challenges that we have. And we're trying to do the best we can in being able to meet those needs. And then finally, there's really the third group in which the environment that has created a support infrastructure to help them manage and be resilient has been really devastated by the pandemic. So you can think about the housing insecurity, food insecurity, the lack of school and socialization component of it. Even unfortunately, as we've all seen, the death of seniors that have been a stabilization force for a number of families. The loss of that supporting environment has created really significant impact on many of those children, undercutting their sources of resiliency and stability. And that's the other group that we feel is at great risk for. And so much of our community engaged activities that we have through our Patrick M. Magoon Institute for Healthy Communities directed at trying to understand those and being able to plug some of those gaps and create a stronger source of foundation for those kids that are super high risk.
Now, throughout the past year, in terms of the volumes that you've seen in patients, requesting services, has it been more of a steady rise, or has it been more of an ebb and flow?
Well, I would actually say it's been a little bit more of the latter or the former in terms of a fairly steady rise. When I think about the various places that we provide this care and have these types of interactions, we have our adolescent program, our Podestack Family Division of Adolescent and Young Adult Medicine that provides medical and mental health services for children and young adults up to the age of 25. And that program is an adolescent medicine focused program that does also engage our mental health components to it, has seen a steady rise, really even pre-pandemic, but it has been accelerated during the pandemic. When I then add on top of that the psychiatry activity that we've had, so that's delivered through our Pritzker Department of Psychiatry and Behavioral Health here, those number of visits went from about 26,000 or so last year last fiscal year to now 31,000 visits this year. So, we're looking at about a 20% increase through the course of the pandemic. And then the compression, we've had some of our inpatient settings, particularly, for example, our partial hospitalization program. It is dependent on a space, and that space has had to be restricted because of social distancing measures that we've had to put in place as well. So some of our capacity in the throes of this surge have been limited. But I would say this steady increase that we have been seeing in mental behavioral health demands pre-pandemic has hit an acceleration through the last year.
I see. In terms of screening and assessing children for behavioral health care issues, I know that many times that recognizing those issues often come down to assessing whether or not a child has had an adverse childhood experience. This whole situation over the past year where children have been isolated for extended periods of time, have had a lack of social contact, would that be considered, or I guess, what are your thoughts on this in terms of the effects that's had on the child's emotional and psychological needs? Could we consider that an adverse childhood experience?
I don't know that we technically have described that as one of the academically defined adverse childhood experiences, or ACEs as they're often referred to. And certainly I would acknowledge I'm not the expert in the space, but we do have some experts like Dr. Nia Hurd-Garris, who is well known for working on ACEs and the impact on children. But I would say that yes, that is a key component of resiliency is the socialization factors, right? The ability to engage with peers and communicate with peers, and to identify and communicate with role models that we see happening so often in the school-based setting. And so certainly the closures of the school has been one component of it. It's certainly not the only component where kids have socialization, but it is certainly an important one. But when we think about the club activities, whether it's the sports activities, whether it's the musics and the arts, the theaters, activities that many kids find that socialization opportunity in, and certainly the sports activities overall in terms of the team-based activities. But even thinking about social aspects like movies, the ability of children to go together to the movies and have an ability to be able to decompress, to share feelings, to receive reinforcement from their peers and seniors and role models has been significantly impacted through this. So when I think about the adverse childhood experience of the pandemic, I actually might say that break of socialization opportunities that kids and young adults have experienced may have been the biggest challenge that they've had to go through. And so again, that has in some circumstances uncovered a lot of underlying mental health challenges and accelerated that. So we're seeing part of that. Beyond that, some of the other social structures like food, housing, other types of resources that have been undercut as well, worsening that component of it. But the vast majority, it's really been folks that have been creative in figuring out opportunities to continue that socialization structure. There certainly is, again, part of the economic disparities that we see across our communities. So resources to enable people to do that creatively are differentiating between the groups. And so that, again, is why thinking through our dedication to those under-resourced communities and trying to work with community-based organizations to meet the needs that we hear from them in creating more socialization opportunities for kids is certainly a key goal that we have at Lurie Children's.
I mean, obviously, for Lurie's, that type of model of care where you're incorporating also not just the clinical needs, but also the social needs of children has been a key part of your success in terms of handling, in terms of care. I'm wondering, do you think that model will gain further traction within the pediatric realm? Due to the fact that what we've seen over the past 12 months, the experience of how the pandemic has highlighted some of the challenges that come when you don't make these considerations?
Well, it raises a couple key components for how we think strategically at Lurie Children's regarding trying to optimize the health and well-being of kids, and that healthcare is more than just medicine and care. It is these additional social determinants, or what we actually call social influencers, because we don't feel that they determine your outcome; they can influence it. What we then try to do is understand how we can mitigate some of those challenges that could influence kids going down a less than optimal developmental pathway from that aspect. So as we consider our approach, we try to span, as we're very well known for the type of tertiary quaternary care that we provide inside the hospital for very complex and critically ill children. But we also continue to expand that care all the way through primary care and into what we describe as your sort of community care. And so that thinking about the medical home for the pediatric patients and the adolescent patient to be in their primary care space, to then partner with the right community-based organizations who understand the needs to optimize some of these factors that can help the child optimally develop, and then working as well with the family and the community-based organizations to do that similarly. So you do need to really turn the dial and move the needle on the outcomes for children. We really do need a fully comprehensive set of partners to work on these aspects. And I think, we don't as a country necessarily think in a child-friendly policy way, but our kids are our future. And this certainly has elevated the risks that we have for their optimal development. And when we think about kids' optimal development, they have to be healthy and they have to be educated. And those are two key priorities. And there's a lot of surrounding environmental factors that influence the optimal attainment of those things. And we as a single pediatric facility can't do that alone. We got to work with a broad community. We have to work with policymakers to make sure that we allocate the resources in the right way, that we allocate the resources to the care models that work the best, and that we work together across the country from a global standpoint, thinking about things like the Medicaid program, reimbursement rates, or some structural things we could talk about there that really could help amplify our efforts as a country to support the most fragile and the most at risk kids in this country. Don't have a voice in voting, but they are our future voices for voting. And so appreciate the opportunity to sort of expand on our vision of what it will take to really move the needle.
Well, Dr. Shanley, thank you very much. We appreciate you making the time again today to talk with us.
Thank you, Mr. Johnson. Really appreciate the opportunity.
Thank you. And I'm Stephen Ross Johnson with Modern Healthcare. Please be sure to come back next Monday for the latest edition of the Checkup. Thank you for watching.